September, as you know, is Prostate Cancer Awareness Month, an issue that hits close to home, and our Amy DuPont is at Genesis Healthcare checking out a non-invasive alternative to surgery for prostate cancer.
Well, good morning. 1 in 7 men will be diagnosed with prostate cancer during some time in their lifetime. But there's cutting-edge technology happening right here in San Diego at Genesis Healthcare. Dr. Shirazi is here to tell us about it. And it looks super high-tech just by walking in this room. Now, it's called the CyberKnife, but there's no surgery involved.
That is absolutely correct. So CyberKnife radiosurgery is an option that uses precise radiation to deliver with sub-millimeter accuracy, and that's the reason of using the word knife, because that's the precision of knife when you cut and you're trying to remove an organ. It is a technology that we brought to San Diego about 10 years ago and has advanced over time, so the machine has become a little bit more sophisticated meantime. The mainstay that allows us to deliver robotic radiation is this robotic arm that manipulates the linear accelerator that you're looking at, that's at the tip of it, and manipulates it with 6 degrees of freedom while a patient is lying on a robotic couch that manipulates the patient. The brain of the operation is outside of the room, where the information is transmitted autonomously, and it manipulates and gives the radiation to the organ that we're trying to treat, in this particular case aiming at the prostate, but it could treat any organ anywhere in the body, even tumors that move in real time. They can be tracked with millimeter accuracy.
When you started using this, you said it was for people that had very early detected cases of prostate cancer, but that has since changed, and you can work with a lot more patients now?
Absolutely. So our first protocols, about 10 years old, was for early stage prostate cancer. It offered an alternative to traditional radiation, which required people coming back and forth for 8 to 9 weeks. And we've been doing that for 10 years now. As of last year, we have a protocol through us and UCLA that allows people with advanced stage of disease and high-risk disease to get CyberKnife radiosurgery as an alternative, and it really is a game changer. What we have also another protocol for people who have failed traditional radiation or other modalities of treatment, and we can use this as a salvage modality.
Wow. Okay, and we were talking, when we think of radiation, we think of it taking a long time. You come in, you have a treatment, you rest and recover, you come back weeks later, but that's not the case with the CyberKnife.
Yeah, so the beauty of this kind of a treatment approach, we call it hypofractionated. We give lesser number of fractions. People get done with their treatment over 1 week.
Wow.
So we start a patient on Monday, they're done by Friday. It's an outpatient procedure. They walk into the room, they drive themselves back and forth, they can usually carry on their daily activities, they come back, they go back to work or carry on their golf game.
And that is amazing for patients. I mean, cancer is scary, and this really is a game changer for quality of life for these patients.
Over the past few years, the way things have gone towards is more minimally invasive procedures, less attacking, less invasion, and this is a perfect translation. Depositing high energy with high focus to an area without really altering a good amount of their quality of life. Anything has side effect. I mean, I'll be lying to you if it has no side effect. Right. Anything has side effect, but the side effect portfolio is very favorable.
And what are the outcomes like for the patients that choose this therapy?
For the early stage prostate cancer in our published series, 98% cure rate in 5 years, which is fantastic. It lives up to the best of all the other options that are out there. For advanced stage, the protocol is very new. It's 1 year old, so I don't know the outcome, no published series on that, but we're here at Genesis, we're really the leading edge technology and advances in terms of any kind of prostate cancer, from the earliest to the most advanced stages. We offer vaccines, we have 20 protocols that people can go on drugs and things that are not even available out there in general practice.
So if someone at home has prostate cancer, or they have a loved one that has prostate cancer and they're unsure of their options, or they want to explore the CyberKnife, how do they find out more about your program, your treatment therapies, and getting here?
Very good. So just go on the website, Genesis Healthcare website, and there's a phone number for CyberKnife. I don't have it memorized. You can just call the office. But anyways, what is really beautiful about this is just one of the arsenals we have in fighting prostate cancer. Early diagnosis helps to cure. If we don't find it early, we don't have as many options. You find it earlier, you have more chance of cure. This is just one of the arsenals, one of the cutting-edge technologies we utilize. We have another technology is called Calypso, and that one is like the GPS of the car. We place markers inside the prostate that tracks the movement of prostate in real time. The only place in the county to be able to deliver that kind of a technology.
Well, this is amazing. Thank you so much for having us this morning. Again, cutting-edge technology when it comes to treating not only prostate cancer but other types of cancers happening right here at Genesis Healthcare in San Diego. Back to you guys.